Has your get up and go got up and went? Perhaps you're busy, but you don't feel well. Perhaps you live a very chaotic life, but it no longer stresses you out. You kind of feel numb. Maybe you've had an experience like I did where I almost got into a horrific car accident. And as I made my way to safety, my child burst into tears, was trembling and freaking out. And I sat there and checked in with myself and I'm like, I am not stressed out at all. Something must be wrong. Well, if you're experiencing anything like that, I want you to know you're in the right place. I'm Dr. Trish Leigh. I help people with autonomic nervous system dysfunction reverse their condition to get over their complex chronic conditions like anxiety, attention, autoimmune, arousal dysfunction, and addiction. If you struggle with any of those, I also want you to know that your air quality or lack thereof could be contributing to it. That was the case with me. So, in this video, let's talk about what if you don't have a stress response? What does that mean for you? What's going on in your brain? And more importantly, what can you do about it? Let's dive in. All right. So, first, if you don't have a stress response, this is red warning lights and bells are flashing and ringing for you. I have talked to so many clients that have recovered from cancer, have recovered from major autoimmune disorders, addictions, chronically working. And these people know they don't have a stress response. But guess what? They only know in hindsight. So please check in with yourself right now or look for some examples in your own existence to see, are you stressed out when it would be appropriate to be stressed out? Like me in that horrific car accident, I actually had to pull off these ninja moves to avoid it. And I did because my nervous system was up here, but my mind and body had calibrated to it so slowly over a decade, I didn't even know it. That was one of the last things that happened to me before my skin erupted, which led to mast cell activation and chronic inflammation. Before I had the physical symptoms, that was the warning bell that gave me pause. And I'm like, man, something must be wrong with me. So please, if you have that, consider it a warning bell and get help. So what it means is that your nervous system has calibrated to being used to being in this incredibly hyper vigilant, all hands on deck, red light, red warning signs. Your mind and body have calibrated to it. You're probably busy handling a lot of stressful things, maybe at work, running your own business. I work with a lot of lawyers, physicians, people who are used to high level of performance and juggling all the balls and not being stressed out by it. But unfortunately, that can put your brain and nervous system in chronic autonomic nervous system dysfunction. What this is that your brain is stuck in something called sympathetic dominance. You're stuck in mini or micro or massive fight or flight at all times, and you don't even feel it anymore because you're stuck in it at all times. Sympathetic dominance. It means your system is no longer going into parasympathetic recovery, rest and relax time. Your system needs that for peak performance, or you get stuck in that stress response and you don't feel it anymore. So it's just as dangerous as being stressed out all the time because your nervous system isn't giving you the warning signs on a regular basis. So you think you're fine until you become completely burnt out or very ill with a complex chronic condition. I remember in my search for a physician to help me, one doctor told me that at least I wasn't at the level where I had tipped over into all of these other worse conditions. Unfortunately, I was on the brink of it because as those words came out of her mouth, literally the next day, I erupted into all the other conditions, chronic fatigue, pain, the Sjogren's syndrome with dry mouth, dry eyes. One time I sat in a lab facility. I needed to produce 3 drops of saliva for a cortisol test. I sat there for 30 minutes. That was another one of those coming home moments where I'm like, I can't produce 1 drop of saliva. I had to leave. I couldn't do the test. It was crazy. It was insane. That was another time where I'm like, I can't produce saliva. Now I go to the dentist and they're like, wow, you have a lot of saliva. I'm like, thank God, right? So if you're experiencing dry mouth, dry eyes, if you look it up, it's going to tell you Etiology unknown. This is what I want you to know. Autonomic nervous system dysfunction. It is stress activation in your brain that is so high that your system then calibrates to it and you just become used to it. But unfortunately, that has a cascading effect in every other aspect of your nervous system, neurotransmitters, hormones, cellular function. It leads to mitochondrial dysfunction. So, what do you do about it? Your brain hack strategy for the day is if sympathetic dominance is the problem, getting into parasympathetic is the solution. So it's imperative that you create more time for rest and relax. That means time for meals. One thing I was doing because I'm a busy mom and CEO and brain health professional is that I was eating really quickly, not sitting down for 30 minutes. Just chewing your food and taking 30 minutes to eat a meal is one way you can get into parasympathetic. Taking walks throughout the day, not on your phone, just letting your mind relax, making sure that you log off for the evening and you get time to just rest and chill and do your favorite hobbies and sit around with your people. More rest, digest, and relax throughout the day. That is your homework so that you can start feeling the stress in your life and start doing something about it. All right, if you want help on the journey, please reach out at youcanhealthyself.com. It's a Dr. Trish Leigh company. You will work with me and my team. We can do a QEEG brain map to see exactly what's happening in your brain and in your nervous system. We can also then program protocols so that I can very specifically help reverse that chronic autonomic nervous system dysfunction, that sympathetic dominance, get your nervous system back on track so you can feel and perform well again. So please reach out. You can download your free guide on how you can heal yourself, the 6-step plan to reverse complex chronic conditions. It'll be a beautiful start for you. All right, until next time, remember, you can heal thyself. You just need help.